Attempts by Republicans in Congress to replace the Affordable Care Act have been meeting with stiff resistance around the country. A little before the most recent Obamacare replacement vote was put off by the Senate, people gathered in Washington to speak out against proposed cutbacks in Medicaid. These would have reduced access to care for the poor and people with disabilities, including children. Among those speaking out were pediatric patients and family members who receive care at Franciscan Children's in Brighton. To tell us about their concerns is our guest from Franciscan Children's, the Director of Strategy and Special Projects, Jennifer Atlas. Thank you very much for being with us, Jennifer.
Thank you so much for having me.
First of all, talk about what you do at Franciscan's and the people you serve there.
Sure. I'm the Director of Strategy and Special Projects at Franciscan Children's. In that, my role is really to think about short-term planning and long-term planning for the hospital, how we respond to different healthcare policies that are out there, our long-term vision and where we want to go and how we get there. In terms of the children that we serve, we're the only pediatric post-acute care institution in the Massachusetts area, and we're also one of the largest providers of pediatric behavioral health services. So we serve a lot of children with medical complexity and behavioral complexity as well.
Well, behavioral complexity, medical, sounds like a broad category, maybe children with autism, maybe some other disabilities. Talk about those problems.
Sure. We do see children with autism, as you mentioned, children who suffer from blindness, hearing issues, children on ventilators. Children may have both medical and behavioral health issues as well. Children who have attempted suicide. We serve quite a broad range.
Well, one of the things that's been going on here around repealing and replacing the Affordable Care Act is the likelihood of reducing Medicaid. Medicaid is money that part of it comes from Washington, part of it comes from the states, and we think of it primarily for poor people and people with disabilities, but talk about the families here because, they could be poor, but some of them might be middle-class families who can't afford to do it on their own, maybe.
That's right, 100%. So many of the families who come to us are on Medicaid already just because of the tremendous expenditures that they've had, prescription drug coverage, hospital visits, doctor's visits, specialist visits. But many of the families who also come to us are on commercial coverage, regular private insurance, and they exhaust their benefits because the care that they need is so extensive. So health is something that impacts everyone and can strike at any time. You can have a baby who's born prematurely, not need Medicaid, and then have a child who needs a surgery for $1 million or more, wind up exhausting all of your private coverage and then need Medicaid. So it really varies.
This is BNN News, and we're talking with Jennifer Atlas from Franciscan Children's in Brighton. One thing that many parents have to contend with is a child who has autism, and one of the things I've learned already from some of my relatives is that you have to intervene early and intensively, and I guess that costs money.
It definitely does. It definitely does. The earlier that we can get to these children, the better off they are. We serve a lot of children who are born prematurely at other hospitals and then come to us to wean off their ventilator or just to feed and grow, as we call them, and get stable enough to go home. And so the earlier that we're able to intervene in those children's lives, the better their prognosis for the future.
Well, you've had some parents here who've had a lot on their plate over the years, and they took off some time recently to go down to Washington, and you went with them. What was that like?
It was such a rewarding experience. So we took one of our patients, his name is Tom Geraci, he's 14 years old, and we also took his mother, Kristen Geraci, and both of them have been such wonderful advocates for Franciscan. Tom has received a variety of both medical and behavioral health services at Franciscan really throughout his childhood. He came to us at 1 or 2 years of age and is now 14 and has been receiving services with us for all of those years. And we went to Washington, D.C. As part of an organized set of family advocacy days last week. We're part of the Children's Hospital Association, which is a network of children's hospitals around the country. And we had the pleasure of going down and meeting with our senators and our representatives to talk about the importance of Medicaid coverage for kids just like Tom and his family, and how 60% of the families that we actually serve in the hospital are Medicaid. So that program is so important to us. And hearing Tom be able to tell his story firsthand to senators and representatives and hear his mom chime in was just so gratifying. And I think the delegation really enjoyed hearing directly from him. They don't get to hear a lot from 14-year-olds.
I imagine one of the other concerns here is not just getting care, but I guess the ability of the person who needs that care to be more, at least somewhat more self-sufficient. Isn't that an issue too?
Yeah, yeah. It's it's tricky in these conversations about self-sufficiency and Medicaid, because so many of the families that we treat, like I said, Medicaid is their only option for getting their bills paid, and we really try at the hospital, I think, to educate parents and families to try and get them to the point where they are self-sufficient, and the children can go home with still a little bit of care, but not to the same degree.
I have to ask you, you've probably seen some of these figures out there about reductions in Medicaid. Everything has been tabled now, is going to be renegotiated, but when I look at some of those numbers, you must have looked at those numbers. What would that mean for what you're doing?
The numbers were really staggering. So the BCRA, Better Care Reconciliation Act, and the House-passed version of the American Health Care Act would have cut as much as $40 billion for children's health funding nationally in the future. And that is a 10% cut, upwards of a 10% cut in children's health funding nationally. So it certainly would have had a big impact on our hospital, as well as other children's hospitals nationwide, in terms of being able to provide the services that we do on a daily basis, high quality, cost-effective care to families all across the region.
Thank you very much for being with us.
Thank you.
Jennifer Atlas from Franciscan Children's in Brighton.